We've all heard of Botox for your forehead wrinkles or crow's feet, but what about to treat excessive blinking?
In fact, there are a lot of other uses for facial Botox that go way beyond cosmetic procedures, and for some people, it's really life-changing.
Yeah, Melissa Cole went off to UConn Health to learn more about it.
Dr. Medina Falcone is an oculoplastic surgeon at UConn Health. She uses Botox for her patients in many different beneficial ways. If you get nervous hearing that word, Botox, she says don't. It's a very safe drug.
So I don't love the term toxin because it makes people think of something scary and dangerous. It is an incredibly safe drug. We've used it for over 40 years now. We know pretty much most of the ins and outs. We know where it goes, we know where it will stay. I like the term a neuromodulator better. I think it kind of explains what it does better as well.
Botox relaxes the muscle that you're injecting into. One of the most common uses of Botox in Dr. Falcone's practice is for patients who have excessive blinking, known as blepharospasm.
So on a normal person, you have an involuntary blink. You're sitting there and talking, eating, drinking, watching TV, and your eyes blink spontaneously on their own. In patients that have blepharospasm, they have an uncontrolled and uncontrollable blink where they are blinking continuously over long periods of times, much more frequently than an average person would. And if you think about it, if your eyes are closed more than they're open, it's very hard to drive, to watch TV, to read your favorite book, or to go down for a walk, to cook your food. So my patients come in because it's affecting activities of their daily life.
For these patients, Dr. Falcone injects Botox into the muscles around the eyelid. The blinking is reduced for about 3 to 4 months, and then the procedure is repeated.
So they're still able to initiate a blink. You're not just walking around with your eyes, stuck open, but you're able to blink, but it is much more controlled and less frequent.
Another use of Botox is for patients who've had Bell's palsy.
So it's a condition where you wake up and all of a sudden in the morning, half of your face is droopy. Now that cranial nerve 7 is no longer functioning. And over time it recovers. So most patients recover. There's some workup that they have to go through to make sure everything else is okay, and they recover just fine. But in some patients, they have what we call aberrant cranial nerve 7 regeneration, where the nerve just doesn't function the way it's supposed to. So these patients have spasming and moving on the affected side. Botox can be used to treat that condition and allow them to have more facial symmetry, better ability to chew and enunciate your words, less spasticity and spasming, and sometimes they can have this strange closure of their eyelid on that side when they're chewing food or talking, and you can use Botox to treat that as well. Botox does not take a muscle that's weak and make it stronger. The idea is that you're always taking something that is overacting, moving too fast, moving too much, moving too strongly, and treating it to slow it down, to relax it so that you're able to have a more symmetrical appearance, less difficulties with whatever you're doing in your daily life, those types of applications.
So really a lot more uses than what we think of in the forehead and just making yourself look more youthful.
Right.
It really can change your life.
Yeah, I mean, I think Botox is kind of an understated drug. It is incredibly safe. I mean, we know what the side effects could be. We know, the type of patients that we shouldn't use it in. It's been around for a long time. I mean, I think it has a lot of applications besides ophthalmology. I know there's applications in neurology, dermatology, or otolaryngology, urology. We kind of use it a lot all over the place in medicine.
And Dr. Falcone does want to remind everyone that Botox isn't permanent. It actually clears out of the body in 3 to 4 months, so then it does need to be repeated. But to learn more, you can go to uconn.health.edu.
Really cool what they can do, right? It's
Yeah.
unbelievable.